Again.
Nice to see you.
I'm Jane. As you know, I work with your cardiologist, Dr. Smith.
Okay.
How are you feeling today?
Pretty good.
Good. You been up walking a little bit?
Probably not as much as I should.
Okay. Okay. We're hoping if you feel okay later today, we'll get you out of the hospital today. And Dr. Smith and I wanted to talk with you a little bit about the medications that you've been taking while you're here in the hospital and what we think might be good ideas of medications that will help you when you leave the hospital. Okay? This is called a risk worksheet, and it talks a little bit about medications that patients following heart attacks typically take. We know that after you've had a heart attack, the first 6 months after the heart attack, your risk of dying is the highest. And your cardiologist, your heart doctor, has prescribed the following medications in efforts to help reduce that risk for you. And this worksheet shows the benefits, or how much we can reduce that risk for you personally, as well as the side effects and the costs of some of the medications. And that may influence your decision to take or not to take these medications. And that's what we want to make sure that you understand. Okay? At the end of this, we're going to talk to you specifically about your decision and what you would like to do as far as your medications. All of the medications that we're going to talk about today are medications that you've been taking while you're here in the hospital. And based on your age and your medical history and your recent heart attack, your personal risk is about 15% of dying of a heart attack over the next 6 months. Okay? Is that more than you thought it might be?
Yeah, that is more than I thought.
Okay. So it's important that we talk about these medicines then.
Okay.
Your recommended heart medications currently, and these are medications again currently that you're taking, are aspirin, a statin or a medication for your cholesterol, an ACE inhibitor, the one you're on is lisinopril, and a beta blocker, metoprolol. And I'll also at the end give you some more information on those medications if you're interested, and we can talk about those more in detail.
Okay.
We'll start off here a little bit. If you look at this picture and look at these dots represent 1,000 people like you that are recovering from a heart attack. Okay? If over the next 6 months of these 1,000 people or these 1,000 dots, if they do not take any of the recommended medications, about 150 of them will die,
That's a lot.
and about 850 will live. Okay? So the green dots represent people who live, and the black dots down here represent people who die. Okay?
Definitely want to be a green dot.
Yeah, you'd like to be a green dot. And if over the next 6 months of those 1,000 people, if they do take their medications, about 75 will still die, represented by the black dots. And about 75 will avoid death. And about 850 will live whether or not they choose to take their medications.
So you're telling me if I take my medications, then I could become one of the yellow dots, which will improve my survivability in the near future.
Sure. With
Okay.
your medications, you can become, within this group of yellow and green dots, people who avoid death.
Oh, okay. Then
And you'll actually decrease your chances from this group of black down to the small group of people who may die.
Okay, I'll be in that group.
Right.
Okay.
Let's just quickly go on the back here and look at these medications again. Again, this talks about some of the common side effects and the costs of your medications.
Okay.
These are the 4 medications, the classes of medications that you're on, and the dollar sign after the medication represents approximate cost for that medication.
So very little?
Very little is
Okay.
aspirin, just $1 sign.
Okay.
And statins or cholesterol medicines, $3 to $4 signs, so a little bit more per month. And as you look down here, somewhere between $25 and $40 a month for a statin.
Okay.
ACE inhibitors and beta blockers. Talks a little bit about some of the potential side effects of those medications in addition to the cost, and you can look through those a little bit.
Okay.
Okay. Based on what you've learned here and what we've talked about, how do you feel about those medications that we currently have prescribed for you, that we think would be better for you?
Well,
Or a
if
good
I
idea.
understand this diagram, or these 2 diagrams, that I can potentially, if, let's say I was one of the black dots, I could potentially become a yellow dot, which means I could potentially become somebody who survives. If I understand it correctly.
Right.
Okay.
And you would increase your chances of surviving by taking all of those medications,
Okay.
if in fact you choose to do so.
So obviously I would want to do so because I
Okay.
want to survive.
Okay? All right, and we'll do that for you then, and we'll
Okay.
prescribe those medications when you leave the hospital.
Okay.
Okay?
Sounds good.
And I'll also leave with you this medication guide.
Okay.
And this has more information that we spoke about, and I'll come back and we'll talk with you more about this later. I'll give you some time to look through this. And
Okay.
this talks about the classes of medications,
Okay.
some of the side effects and the benefits. But you may have more questions after you have that, but we'll go ahead and order those medications for you then while you're here in the hospital.
Okay.
And get your dismissal paperwork ready to go.
Okay.
All right.
And I'll try to get up a little bit more.
Okay.
Okay.
We'll talk to you later.
Thank you.